We're back again. This is John Lynn from EMRandHIPAA.com. We're going to answer another question about healthcare IT and electronic medical record. So this question comes from @HWIntegrator from Twitter. His name is Sean Myers. And he asked the question, how can healthcare IT help patients take a more active role in their care? Now, this is a really interesting one, and really hits at the heart of it is the PHR, the personal health record. So that is where I think the patients can be most involved in their care. And this is especially true for a chronic patient that wants to manage their care across multiple doctors and be able to know what each doctor's documented and to be able to share that information with the doctors that they get in the future. Now, the problem with PHRs right now is that they're not very well connected to the doctor's office. So unfortunately, a lot of the input of the information into the PHR has to be done manually. So it's kind of a pain in the rear end to get all that information. Although it's getting better, and there is some standards. CCD is quite popular, CCR is available, and a lot of the EMR vendors are starting to work with those standards, and they're starting to make it available for the PHRs. But the problem is they're not quite there yet. And then we still only have 25% or somewhere in that neighborhood of doctors that use an electronic medical record. So they're not really going to export their paper charts to your PHR anyways. So I mean, maybe you could scan and upload them yourself. So that's one way, is by getting that information into a PHR, you could look at it and see what the doctor said. You can hopefully see if they're doing things right, understand what they're doing, and then with that data and that information, although you could certainly do this off paper as well, you can actually play an active role. There's so many websites out there for patients with healthcare information. Now, a lot of doctors are a little nervous about having an active patient, or there's kind of a movement called e-patient, the e-patient, the patient that goes online to understand their healthcare. But a lot of doctors are really coming around, and they like to have the patient involved. They want to have the patient's input and the patient's feedback, as long as the patient does it in a respectful and appropriate manner. Certainly there's some that aren't as respectful, and of course, if I were a doctor, I wouldn't like that either. But healthcare IT, through apps on your phone, through websites that have health information, Google I think is a pretty good resource, although you have to be careful when you're reading it. But it gives you that information so you can have a more intelligent discussion with your doctor, which is something that should provide better medical care. So those are just a few of the things by having a PHR, by researching and being active in your patient care so that when you go to the doctor you're informed and you can have a smart discussion with them. Then you can actually improve patient care through healthcare IT. Then there's also other ways through patient portals that doctors can provide, where you can interact with your doctor through a portal so you don't have to go there, which is often, I think it could be a really good benefit, because people are more likely to ask their doctor early on and find out if something's really an issue and maybe go in for a visit, as opposed to them just deciding not to go in and then the condition worsens and then they don't get as good a health. So the patient portal with access to email your doctor or communicate with your doctor is another possible way. So those are a few ways that healthcare IT can help patients take a more active role in their healthcare.